these heart points and lung points get interesting and tricky. And we're going to do more of these on somebody who has neck pain, so we'll do them again, I think, depending on what she has. We'll see. You've got a very nice pisiform.
Whoa.
Is there something unusual about your pisiform, or is this just the shape of you? Wow, that's cool. So we can really see, this is her heel, right? Right? So this is her heel. So as her tendon comes in and attaches on the pisiform, you can't miss. That's the calcaneus for her. So if she had heel pain, we're right on this guy, right? We're going to needle and needle the side and needle the back and needle the front and needle the other side. All the way around this is the heel itself. If it comes on, if she had plantar fasciitis and it came onto the hand, we'd come onto the hand more. Here's the arch down the spleen channel, right? Here's kidney 2 and 6 is kind of in this area, and then this goes towards the ball of the foot, right? So in this case, we're doing the heart points, and usually heart channel's running along here, right, on the inside of this flexor carpi ulnaris, which is, can you resist against my hand here? Yeah, can't see much. Yours is a bit deep, but it's running right here, right? And so usually it's on the inside of that. Go ahead and relax. So usually we're needling it this way. Ton used to always teach that we needle it from the side, this way. And for hands in this position, all the tissue is flattening against the ulna here. So you don't have a whole lot of room, right, to get in here. If we turn the hand, sorry you can't see this, the other way, lots of room. So let me show them on your other hand. Can I do that real quick? Perfect. Perfect. So again, if we're this way, not a bunch of room here, this extensor tendon, flexor carpi, is flattening against the ulna, and it's also flattening artery, vein, nerve. So those are the things we want to be careful of. I don't know if anybody else is bruised somewhere in this area, but they end up being big fat bruises. Try to avoid that. But if we go this direction, now, see the tendon is here. You can actually see the edge of the tendon here, and there's tons of room. I can get my whole finger in there, right? So I prefer to needle it in this position with the hand prone, and then you've got lots of space to get your needle in. So doing it over here is okay?
Yeah.
Let's put this one right there. That's a very good spot. As long as her she doesn't get numb and tingly on this lateral 2 fingers. Sometimes the table squeezes the ulnar nerve, and we just put a little pad under there if that happens. So I'll do a couple of heart points. We'll start with heart 4, which is basically gallbladder 21. It treats gallbladder 21, so we'll do it, kind of get you just a little bit more. Is that okay?
Mm-hmm.
Great. So we're going to go about here. Is that okay?
Mm-hmm.
Great. So we're going to go a little bit slowly to make sure that we don't run into anything vital.
Are you going over or under the nerve?
See, that's the question.
That is a good one,
We
isn't
don't
it?
know. Yeah, it varies on the person. Yeah, we're kind of flying a little blind, honestly. But we're going slow enough to where if she starts to get a tickle, we stop, right? If you just throw it in, you don't know, right? And that's when you do things like puncture veins, right? We don't want that. No problem?
Fine.
Totally fine. So that would treat gallbladder 21 pain. So if she had, which she feels really soft for but usually if somebody has a lot of pain at gallbladder 21, that's our spot. If the pain is all the way up the occiput, gallbladder 20, then the heart 7, which we were talking about earlier, is on the other side of the pisiform bone, right? So you'd see that if we wanted to get to this spot, right? And if we're doing it from the side, we've got a bone in our way. So in order to get to it, we have to come lower and then angle around the pisiform to it, right? Kind of at an angle. So it's kind of a threaded heart 7, I guess. So we're going to find her pisiform, which is right here. My middle finger's on it there. And I'm going to come distal to that, and then we're going to angle it back up around it. So we're going to start here at where I would go in for like heart 6, right? And then we're going to angle up and around pisiform.
Ooh,
Was that zingy?
no, heavy.
Heavy. So that's not nerve. Great. Good to know. So is it calmed down now?
Mm-hmm.
Okay. So now I don't mind continuing because that's not the depth we want, right? So to release gallbladder 20, even though she got a reaction here, it's not going to do it. It's not far enough. It has to get to the other side or else it won't release. So then we're going to keep going. So it was heavy, and then it stopped being heavy. It's heavy again, or?
Yeah, dull.
It's okay?
Yeah, it's tolerable.
Great. And we continue. Still okay?
Mm-hmm.
Great. And there we are. Not quite as much of an angle as I wanted, but it's okay, and it will release not all the way at the occiput itself, but it'll be just a little lower since my angle isn't quite as sharp. I wanted more like this angle, right? I'm kind of reaching over her, so it's not as easy. Can I do one on this side as well?
Mm-hmm.
Thank you very much. You're being great. These are all not too painful.
No, not bad at all.
Thank you so much.
Thank you for using 38s.
This is what I use, so I would feel funny using something else, actually. Glad they have them. So here we are, pisiform. Here we are, heart 7. Sorry, heart 6 level. But instead of going straight in, we're angling it. There's the angle I want. See, I just ran into pisiform, so we're going to back up, go around it a little bit. There we go. And we just missed the edge of it, and now we can get our angle more correctly. So that's more like right at heart 7. So if we can pick this up, we can look at our angle. This is where our needle goes, right?
Perfect.
Yeah. If you got it a little farther, you could get closer, like right in, tuck it up under it, but I like it this way. It's pretty good. That should get it. If there's an occipital issue, that should get it if it's gallbladder channel, right?
Have you ever tried a
Comfortable?
longer needle? Like for somebody who has GP pain all the way, and then
All
you
the way.
use like a 3-2 needle to thread all the way.
Usually I'll just use multiple needles because the channel is under the tendon, so if I started here and went like all the way along, I'm not deep enough on the first ones to get the channel because it's under the tendon. It takes multiple needles. So if they did have it like all the way down triple warmer, it's going to be heart 4, heart 5, heart 6, and heart 7. Sometimes they get 4 needles right there.